I think you are partly responsible why that treatment is not working. And that would cost the patient and the family a lot more money than he can afford to give. This again is a slide that amplifies my point by saying that depression is comorbid with so many other physical disorders, and I'm not going to take you through one by one, but you can see at the bottom, when you have Parkinsonism, more than 50% of patients with Parkinsonism are going to have depression. And the list of the other things are given there. Now, I'd like to point out your attention to this monumental study that was done the world over by Moussavi and his colleagues. Psychiatrists have been trying to measure the burden of diseases by many parameters. They looked at the quality of life, they looked at the disability-adjusted life years, and in this study, which was carried out in 60 countries with more than 240,000 people, Moussavi et al. Used what they call as a mean health score. They calculated the health scores of all physical disorders alone, and they calculated the physical and the health scores of the comorbid depression and diabetes, depression and hypertension, depression and cardiovascular diseases. And this is a graph which may be a little difficult to understand because my graphic sense wasn't able to give me the clarity in that. But these are the findings of that study that you need to know. That depression had the largest effect on worsening mean health scores compared with other chronic conditions. Depression produced the greatest detriment in health compared with the chronic diseases, angina, arthritis, asthma, and diabetes. The comorbid state of depression incrementally worsens health compared with depression alone, with any of the chronic diseases alone, and with any combination of chronic disease without depression. So with this, you would know that the combination is a disastrous combination in terms of the mean health scores. Now, this is a slide which will talk about what is the mechanism of depression and the medical comorbidity. The hypotheses are given here that it can be an independent phenomena, or it can be precipitated by the stress of medical conditions, or the medical conditions precede depression and is felt to have a pathophysiological effect, or it can be a substance-induced response. And lastly, people have hypothesized that depressive symptoms are a normal response to being severely ill. After all, when you diagnose a patient to be suffering from diabetes, have you ever heard what happens to that patient? I went for my cardiac checkup, and I was sitting with this renowned cardiologist in the Twin Cities of Rawalpindi, Islamabad. A patient came in who had his angiography done and all the workup for the cardiovascular disorder. The cardiologist looks at the reports and says, well, your 3 vessels are blocked. I don't think I can do anything for you. Now I'm referring you to the cardiac surgeon. You please go and God be with you. That's the information that the cardiologist gave to this patient who was 45 years of age. And I was sitting there as a patient myself, and I just looked at the expressions on the patient's face. I think he understood nothing what would happen to him after he goes out of that doctor's office. Because the psychology would start to go wrong. And when the psychology starts to go wrong, symptoms of